Okay, everyone, what I'm about to reveal is going to shock you. My name is Tina Olivero. I'm with Guardians of Recovery, blowing the whistle on all of this harm reduction, low barrier money-making scheme that's happening with your tax dollars. Today, we're talking about the alcohol managed program. You might not like the truth, but here it is. In St. John's last year, nearly $400,000 of your taxpayer money went to the Status of Women's Council Alcohol Managed Program in 2024. We ATIPP that information from the government to see how bad things really were, and the numbers are shocking. Wait till you see how it all stacks up. What did we get for $400,000? Free booze for alcoholics delivered directly to them in public spaces like parks, public streets, even to their doors. Meanwhile, if someone wants rehab or treatment, they have to wait months and months and months just to get in. WTF? What's wrong with that picture? Here's how the money breaks down. And pay attention because it is jaw-dropping what's going on here. First of all, we got to pay the harm reduction case manager. That person gets $81,600. Then there's a full-time harm reduction outreach worker, $66,000 for that position. Then there's a part-time harm reduction outreach worker. That person gets $60,000. I don't know why there's a $6,000 difference between full-time and part-time. None of that makes sense, but anyway, there it is. Those are the actual numbers. Then there's a relief staff person for another $15,000 when everybody goes on vacation, I suppose. Then there's rent and utilities for $19,500. Then there's administrative costs of $40,000 to administer this program. Then there's research costs of $30,000. What are they researching? Where is the research? What's the research saying? I want to know. I'm interested in reading what kind of research and what kind of outcomes they're actually getting by giving alcoholics more alcohol. Any brain scans done? You bet your bottom dollar there's not. Then there's individual supports and outreach supplies for another $1,000. There's a peer support program for $6,300. And then they finally get down to it. They spent $70,000 on alcohol. So you're buying booze for people with alcohol addiction. $70,000 for a grand total of $396,920. That's right, folks. Almost $400,000, most of it going to salaries, just to administer $70,000 worth of booze to alcoholics. Do you see the problem here? Most of the money is salaries, administration, and overhead, and all of it just to hand out $70,000 worth of booze, beer. So why do we need all those positions just for that? That doesn't add up. Your taxpayer dollars. Meanwhile, what's actually happening to the people who are getting this free alcohol? I've seen it in action in public places being dropped off down at Ben's Park. Do they get more brain damage? Alcohol kills brain cells, destroys memory, worsens mental health, stops people from having normal cause and effect. These are healthy things that we need in our brain to make life-saving decisions. No, it fosters more addiction. If you keep feeding someone's addiction, why would they ever seek recovery? It creates more dependency. They're trapped in the cycle of addiction for longer with no incentive to change. Where are the roads to recovery? This is not care. This is harm production. They wrap it all up in neat little words and call it harm reduction. That's manipulation. That's not harm reduction. We are playing God with people's lives, distributing poison under the guise of compassion to people who are deeply, deeply addicted, keeping them there and paying all these harm reduction jobs. And yet, if someone wants real rehab, to get to a bed, they have to wait months just to get there. But if they want beer delivered, they can get it instantly, no questions asked. Like, think about that, folks. You can get beer in a public park or right to your door, but if you want a chance to live and recover, you actually have to wait. You can't get into detox immediately. You can't get into rehab immediately. There's no on-demand rehab and detox here. There needs to be, should be the top priority. It should be where this money is going. But what are we doing? We're pouring it down the drain with harm reduction. We're prioritizing alcohol to people who are addicts over recovery, bureaucracy over human life, and programs over hope. Taxpayers are funding it, and the people suffering are getting sicker, not better. Where's the studies that say that this is working? Stop with the harm reduction BS, because I have yet to see the research that this is actually doing good. When you look out there in our city, when you see what's happening around the province, is harm reduction, low barrier shelters working? No, it's keeping people in the cycle of addiction. Harm reduction may have its place as a bridge to recovery, but not the total program with no way out. Harm reduction may have a role in small places. For example, someone who's detoxing from alcohol may need alcohol as a bridge for a couple of days to get them into detox. But that's the extent of it. They don't get never-ending alcohol as they continue to battle their addiction and make things worse, cause more brain damage. But that's the extent of where we are right now. We offer them Band-Aid solutions with no way out. This is wrong. What we cannot continue to do is a daily delivery service of free booze funded by taxpayers, keeping people trapped in addiction with no hope or recovery. That was just 2024. Imagine 2023, 2022, start adding up the years. How much money are we spending? How many recovery homes could we actually have in place with all of that money? And don't get me started on low barrier shelters. That's actually where my son was when he passed away. Like, there's so many kids dying in that situation. It is criminal. All roads must lead to recovery. If we ever want to beat this thing, that means rehab on demand, treatment, support programs, and accountability, responsibility, long-term sober living homes, not endless handouts of poison disguised as care. This is harm reduction, plain and simple. It's time to wake up, people, and demand change and put recovery first for your tax dollars, because lives here are at stake. We're seeing what doesn't work. We're dealing with it every single day in our community. We are standing up against the current system. We're having a rally because all of this has gotten so out of control that every single community is now experiencing mass crime, because harm reduction and low barrier shelters are enabling a whole entire drug culture, which is leading to mass addiction with very, very serious drugs and, of course, desperate crimes in our community. That's what's going on. And the government is exacerbating that by providing all the drug tools you need to use your crack pipe. Here it is. No, you can't get into recovery right now, but here's your crack pipe, here's your needle, here's your alcohol, and your taxes are paying for it, and it's happening year over year over year in the cycle. That is wrong. So stand up with us September 11th from 12 to 2. We are having a province-wide rally and saying no more. We want all roads leading to recovery. We want drug dogs at every port of entry in the province. We want to make sure that our streets are safe and sound. We want our tax money going to recovery-focused on-demand rehab, on-demand sober living homes long-term, so people actually get care, and recover. That's my message for today. I'm Tina Olivero. My son Ben died of a fentanyl overdose in a low barrier shelter. He was enabled in drug use and addiction for 5 years under the harm reduction banner. I'm angry. I'm upset that this system, paid for by our taxes, actually had a hand in taking my son's life. It's wrong. It needs to stop. It's not just me. I'm working with thousands and thousands of other parents in Newfoundland and Labrador whose kids are on death's door dealing with the exact same thing, and also parents who have lost their kids, and it's irreversible. We have to stop the madness. We have to change this around. That's my message. Next time when you're going to vote, make sure you vote for the people. Ask your leaders who are stepping up in the next election, do you believe in the culture we have of harm reduction? Or what's your solution to the mass drugs and addiction and crime? Ask them outright. They're afraid to tell you because they're afraid of losing votes. They're afraid to take a stand. The only leader that you actually need to vote for and should vote for is the one who will answer those questions. Over and out.